Good morning, people. I'm Kavitha, founder of Totsandmoms, and today we are going on live with Dr. Smrithi Gaurang, who's a pediatrician. The topic of discussion today is gut health and allergies. I will add her now, and people please join in because this is going to be a very informative session. Gut health is something that everybody is focusing now because they know how important it is, and allergies due to seasonal change is very common in children, and this video will help you understand how to take care of your children well. I'm adding Dr. Smrithi. She's a pediatrician. Yes, I see that she's joined in already. Welcome, Dr. Smrithi. It is pleasure having you here in the session today. Being a pediatrician, you making time for us is an amazing thing, and I'm sure our audience are way too excited, and we have few people already join in. And I will
Yes,
give
yes,
this.
you are.
Am I audible to you? Because okay,
Thank you so much,
you are audible
Kavitha,
as well.
for having me here. And we have the privilege part of this community that you have built. I see all of you all are
model we will run on it, and then towards the end we will also be happy to take up your questions related to the same topic. So please feel free to be participating, engaging, and also asking any questions that you want to know related to the topic.
So thank
Over
you
to
so much
Dr.
again, Kavitha. I'm so happy to be here. And I see so many enthusiastic parents and caregivers, as well as people who are just interested to know more about gut and its, mystifying properties. So I am Dr. Smrithi. I'm a pediatrician and a pediatric geneticist. I practice at Arka AV Hospital in JP Nagar, as well as AV Hospital in Baswangudi. So this, I would say this topic came to my mind because I was really inspired by your community as well. So you are somebody who really believes in the power of gut. And now the pressing issue for all caregivers and parents is that the seasons are changing so rapidly. So all kids are down with some form of allergy or the other. Some of them are concerning, some are just mild, of course, majority, but sometimes it does cause some serious side effects. So they are all worried about it. So I thought it would be appropriate to address this and see how these two might be linked in a way. So we'll just dive into it. Before anything, what is an allergy? So allergy,
Yeah, we would want to know that how is this allergy an issue with the seasonal change? I know we have a set of questions, but in introduction, let us tell them a brief about gut health
yes.
and allergy.
So,
And then dive
firstly,
into
just
questions.
let me tell you what is allergy in very simple terms. It's nothing but there is a mistaken identity. What happens is the body is perceiving something which is non-threatening as something harmful and starts to react against it. So often we see a lot of different mechanisms are given to say that an allergy can be due to this, this, and this. But there are three pillars which mainly lead to an allergy. First would be genetics, but genetics is a very small component of it because they say that if parents, both of them have a tendency to allergy, then the kid has an increased chance, maybe 1 in 2 chance. Or if a sibling has, definitely the chance that the child will have an allergy also increases. The second thing would be our environment, that is our exposures, maybe to toxins or water or air that we breathe. Anything that brings in toxins is again a risk. The third is the immune system itself. Now, what we are discussing, that gut and allergies mainly comes under this particular heading. That is because how the gut helps in immunomodulation is what we are going to be studying today. So when we talk about allergies, what are the common things that come to your mind? Usually, this we see as a, depending on the age of the child, the allergic manifestations also are different. Now, if you talk to a mother who has a very small kid, maybe 1 to 2 years, their main issue will be that, yeah, my kid keeps getting some rashes on and off, usually, over the knees and the elbows, face and scalp, and it's very itchy. The more the baby tries to scratch, more rash. So this is something we call as eczema. So this is one type of a reaction which is seen in very young age. As they grow up, what are the different allergy manifestations you can see? One is you see that running nose, eyes are watering. We call that rhinoconjunctivitis. or some of them have a more serious manifestation that will be in the form of asthma. Asthma is something we are all afraid of, all aware of, afraid of, and don't want to ever have it. So yeah, that is also an allergic manifestation by the body. And last is usually we have another whole set of allergies called food allergies. So if you have any queries regarding this, Kavitha, we can discuss a little bit in detail about them.
Yes, we will take it up as
Yeah.
and when we complete our regular questions that we have noted down.
Yeah.
And then we'll give
So,
them an opportunity as well.
Yeah.
Okay, fine, doctor. The first question is partially answered. The first question for the day is, what are the common allergies encountered in
So
children?
usually we, of course, there can be a million allergies to different components, but the common ones we see in our country and in this side of our country also would be like this rhinoconjunctivitis, that is hay fever, and the skin allergies called eczemas, as well as asthmas. Food allergies per se are not that common. I mean, we could say that previously very confidently, saying, Asian countries don't have much food allergies. Now, because of change in diet, even that scenario is changing. But definitely, as compared to the West, we have we don't have that much of food allergies.
Okay. Now, the main question: what is the link between
so
gut
this is
health
a very curious thing. For a very long period of time, we thought gut is just nothing but taking in food, assimilating, and excretion. That was all that was thought of. But slowly now there's a big paradigm shift. We are seeing that the gut microbiota it's in itself a whole organ actually. So it's curious to know that the genetic material, the bacteria in our gut is more than the human DNA actually. So it's such a vast organ, and this mainly helps in a lot of functions that we still don't know. We are still studying actually. And what happens is that the gut microbiota, usually the development starts from the time of our birth also. And like you must be, all mothers are aware that all of them advise as opposed to cesarean section whenever possible. That because the seeding of that whole intestine of the baby happens during birth. So when it is a vaginal birth, it is mainly lined by the birth canal microorganisms. The baby will get the microorganisms in the birth canal. Whereas in case of cesarean section, there is a tendency towards the skin microorganisms of the mother. So that first seeding happens at birth. Then after that, everything is like a step by step. So this is all initiation of the gut microbiome. Second thing which is important for the development of microorganisms is your feeding. So first, we know that up to 6 months, everybody is always advising you to give breast milk. Why breast milk? Breast milk by itself also has a lot of prebiotics, probiotics, as well as that are important for development of the gut. And what is seen is when you're breastfeeding, there is a like feedback mechanism through the nipples, through which even the mother's gut microorganisms gets passed on to the baby's microorganism. So a lot of research is going on. So this is how the gut microbiota gets developed. And we see that it forms about 30% of the immune system. We feel that, tonsils are important, lymph nodes are important. These we typically study as, organs. But actually 30 to 40% of the immune system is managed by the gut bacteria. So
that's what was to be my next question. Out of the list, I am very curious in understanding how is the shift till 7-8 years, at least when my older child, who is 9 years currently, we were talking about majorly immunity or other health. Okay, but recently we see a lot of talk about gut health, prebiotic, probiotic. What is the shift? Was there a health change that happened?
Actually, a lot of studies are going on because it's not an easy task. You should remember that gut microorganism is as unique as your fingerprint. So each person's is different. To study, yeah. So we didn't have so much access to study previously. But slowly they started noticing that all factors are similar. Okay, your environment is the same, your genetics are the same. and maybe your gut health is slightly varying in different countries. So how that started influencing many diseases and many chronic diseases, in fact. It's not only allergies, all the metabolic disorders have a role in, I mean, the gut has a role in metabolic diseases like diabetes, and even in things like autism also, they say that, gut composition plays a role in how exactly it manifests in this thing. So recently the interest has peaked, of course, but this was always the truth. And basically in India, like, our people were very clever. They have established rules so that we take care of our gut from the time baby is born. So like how we advise exclusive breastfeeding till 6 months and continuing even after you start solid. That is a very important practice, because I just mentioned how breast milk feeds our gut bacteria. We have something known as HMOs in the breast milk. These mainly give nourishment to the good bacteria in our gut. So that is why we say that. But there is no need to, I mean, see, not all mothers will be able to successfully breastfeed, and that is a reality. So if that happens, what we should remember is a good alternative would be to try mixed feeding. At least if you ensure you give some amount of breast milk to the baby and supplement it further, then that is also a good option. Of course, if there is no other go and you have to go for some other top feeding, then you can always talk to your pediatrician about how you can maintain the gut health of your baby. Because, I mean, mom guilt is not a good thing, and we should never, everybody's always trying their best. So that is not the way to go. Always make sure we basically want to give the best for all babies.
Definitely. Well said, doctor. And even in last video where we had Dr. Gaurang, he was also talking about gut health being set while the vaginal delivery happens. The microbiome that is taken in by the child, it helps it vast. And that is why also we had last month being C-section awareness month, wherein a lot of mothers who are pushed into C-section can be aware of the scenarios they have to opt for it, not just go by it because somebody said. Be well aware and opt for it. So breastfeeding, vaginal delivery, and taking care of oneself during pregnancy, all that is interrelated and acts a lot in gut health of one's child, is what I totally understand.
So we have covered. What else can you do to help? Can you hear me?
Yes.
Okay.
Sometimes in between,
I
I'm
hope this is
losing
fine
you.
now. Okay.
Yes.
So just hold on a moment, that light will come back. So we have now come up to 6 months. So beyond 6 months, what are the things that you can do to contribute to the good health of your baby? We Indians are very good. We are practicing the norm, that is exclusive feeding till 6 months, and then we start solids. And our solids are very unique. We start with millets, and we always encourage adding some amount of nuts like peanuts or powder, or some form of dry fruits which is made into powder, and we add it. So there's good amount of protein, good amount of carbohydrates, as well as the so-called allergens. So from 6 to 9 months only we start adding the so-called allergens into the baby's diet. So you're giving the baby's gut a chance to get to know these and also understand, okay, this is not harmful. It is self. It is not external factor that I should fight against. So from a very young age, we are training the baby's immune system to know that these are not harmful substances. So that is an excellent thing that we do. In addition, we add things like ghee, very healthy fats that also maintains the integrity of the gut. So these are all very healthy practices that we must make sure that we continue. And I believe the same with you, that also encourage using very.
And I was also writing an article, bringing in few studies, and I make short videos. One of it, which is going to be recorded today, was about allergens to be introduced before an year, and why and how important it is, so that later stage your child does not have allergy issues like eczema or vomiting, things like that. Adding on, we Indians have this acquired knowledge. Sometimes it is good, sometimes it is bad, because we peanuts, dry fruits are to be delayed after a year. There was also a rule for a while where 3 days rule was being followed, and also one said now that is ruled out. Our children have to be exposed to multiple foods, especially whatever we have as an individual at a home as our tradition. It's not that we have that
Exactly.
North Indian food or South Indian, I mean, North Indians including something which is South Indian. So go by eating
Exactly.
local, go by eating seasonal, go by eating which is cultural, and definitely our children will be well adapted to it. And that unwanted fear can be taken out if we ensure that we feed all that in that first year, was what I
Yeah,
studied, and I'm going to
you're
put it in a
absolutely
short
right.
form of a video.
Yeah.
I hope I said the right
No,
things.
you're
Please correct me
absolutely
wherever
right.
I'm
And I
wrong.
really appreciate you saying that there's no more 3-day rule. That is really true, because initially they used to say you introduce a food and wait for 3 days, see for reaction, and then only introduce a new food. That has so many disadvantages, and Indian Pediatric Association also does not agree with it anymore. That is because there's a very narrow window where you can introduce a lot of new food for the very, very curious to try new things. They have that it's a mouthing phase where they are very curious to put everything in the mouth. So if you miss window waiting for three
Yeah.
days, then the food you can play with ultimately is very limited.
We are at one end
Yeah.
consciously even boring the child. Scientifically,
Exactly.
there are
And
other
also,
side effects.
whatever reactions we expect, all of them take a maximum of 24 hours. Nothing goes beyond that. There is no point delaying it further. So please
Okay.
don't have any fear. Introduce all kinds of solids to the baby once baby is ready to start eating. So there are few cues that you can observe when the baby is ready for eating to start solids. Now your baby should be able to sit a little erect with some minimal support, and baby should be able to reach for objects. Baby is showing signs that we say something called the tongue thrust, that when you put in the mouth they start pushing the food out. That will
Correct.
stop by 6 months, and mouthing will start. They take everything, try to put it in the mouth. Don't remove anything. That is how they are exploring the surroundings. It's a developmental milestone, in fact. So when they start showing these signs,
Correct. They are
yeah,
worried about the bacteria, but we should understand this is definitely
correct,
made to build on their gut
exactly.
health and
So when
immunity
a
in
baby,
turn. Too much
yeah.
hype is
So when
not
baby shows
necessary.
these certain signs, you know your baby is ready for solids. So with no fear in your mind, please start all solids. And once there's no need to, exactly make a paste or anything. You have to first, of course, I'm sure all mothers now are very well versed with baby-led weaning. So once you feel your baby is ready, you can always encourage giving a little modified food of your family pot. You can offer it to the food, and please ensure that the diversity is there before your baby hits 9 months. All kinds of food should be introduced so that the immune system has a chance to understand, study, and realize that these are not allergens, but these are healthy foods that are being offered.
Correct. One thing I drew from your conversation while I was talking was you said if there is any
Yes,
allergy, it would
absolutely.
show up within 24 hours. So if I have introduced any common allergen
Yes.
to my child, I should observe for 24 hours, and if the child is
Yes,
okay,
yes,
after that
that
I
is
need not
right.
worry, is what you saying.
Of course, the first
Okay.
month you will be a little more observant. Look for very subtle signs. What are the signs that your kid is maybe allergic to a certain food? Is usually three parts we see this. First is you see signs in the skin. You can see skin rashes. Second is in the gut. That is there is some colic pain, or baby is passing loose motions, or baby is passing a lot of gas, or there is a rash in that anal region, in the motion region. And another system that commonly we see features are in the respiratory. Baby may have sudden coughs, may have some wheezing. So if you notice any of these changes, please see your doctor, and you can discuss the possibility of a food allergy. But also one comforting thing is a lot of foods, even if child is not able to tolerate initially, gradually as the child grows up, the tolerance improves. I mean, the repeated exposure in very minute quantities sometimes makes the gut, become more immune. I mean, that allergy component goes off. So that is one thing which is a bit reassuring.
Yeah, and another study as per for the same article that I did and wrote down was once you introduce this common allergens, make it a practice that you give it often, at least monthly, 3-4 times, and not just forget that your baby is good to it and then introduce after a year.
So
It
this
may
is
again show up,
why
right?
we say this is because your but your repeat
We're losing
So
your
your
voice in
first
between.
exposure is nothing but a sensitization. You just come and you start it. But your first exposures are when you see if the body reacts. So one exposure will not do it. You will have to see a couple of times and observe. Of course, the common allergens, we usually 12 groups of foods are there. But in India, that of course, it's only increasing very recently. Before, we had not heard of something called peanut allergy. But very slowly, we are catching up with the Westerners, and we have these increased numbers. So cow's milk is one where you can have allergy. You can have allergy with peanuts. You can have with all the tree nuts. That is all the nuts that we use as dry fruits. Then you can have for seafood, sometimes shellfish we call. That is another allergen, and egg. These are 5 things that in India we are seeing slowly, which is increasing in number. But other additives that they add in other food like coloring agents and other toxins, of course, they can also mount an allergic response.
Fine, doctor. Thank you so much. I will take up the next question. What exactly are pre-pro symbiotics and how do they work? Because we all see so many packaged drinks coming up now.
Yeah.
People,
Yeah.
please tell us if the voice is okay now. I see
Yeah.
voice is breaking. Please confirm.
I just want to know if
So
voice
that
is
doctor
breaking,
can.
please. Yeah.
Yeah, please mention if doctor's
Yeah.
voice is not audible or mine. Hi, viewers. Thank you for joining in. I'm sure you're loving the answers and the topic because this is something, as I said in the beginning of the video, we are all exploring, understanding about gut health and allergies were always there, but not
Correct.
at this scale that we had to worry about. But recently, each and every parent, so please stay with
Yeah.
us till the video ends. And for somebody who's joined in now, I will definitely save this video so that you will be able to refer to
So
this
please,
later.
can you
Watch it at
please
your ease.
confirm if
Okay.
the voice is better now? So
Yeah. Shravanti, anybody in my
it's
team,
working. Thank you. Thank
let us
you,
know.
Shivniti. So you wanted to know about the biotics. These are like the new.
Yeah. Also, what are these pre-pro symbiotics? How do they work? And also these commercial packages that we see in all the commercial brands that are coming up. Is that necessary for us to give, or any Indian natural
Sure.
way that we can?
So the biotics are like the new kids on the block. So there is a subtle difference in what these are. Basically, probiotics means these are nothing but the healthy gut bacteria, which is given, which will benefit if taken in a particular dose. So that is one important thing. It's important that we give the correct strain in the correct dose, and that only will cause the benefit in the gut. So of course many are available. Usually these are also prescribed by doctors, but the interesting thing is we have many strains, about 700 strains. But we have noticed that there are few strains important in the correct amount. But just for maintenance of gut, see, better than drinking a fizz drink, it is better your kid has some other probiotic drink. So of course, in that way, it is a good choice, but not when your child needs any medical help, I mean. So this is what probiotics are. Now, prebiotics are nothing but the food that the gut bacteria feed on. So these are usually in the form of your fruits and vegetables. In fruits, I would say a little slightly raw banana is a very good prebiotic. So that usually helps in a lot of, when there is a dysbiosis, we encourage them to give slightly raw banana. Apple you can give, onion you can give garlic, leeks, and these green leafy vegetables. These are all foods which mainly act as nutrition to your gut bacteria. And what is symbiotics is when pre and probiotics are given together. A good example of this is curd. Curd is actually the answer to everything. There is nutrition for the bacteria in the form of short chain fatty acids when it is broken down, as well as itself it contains lactobacillus, which is again a very good gut friendly bacteria. And now we have something new called postbiotics, where you take the dead healthy microorganisms and you send it to your gut for repair, and also some components that are required is also included in that. So these are all the biotics, but no need to get confused. In basically through natural foods also we can get it. Like I said, your dairy products such as
Even our has all of it that is needed. We just have to get back to our roots, make that Indian
Exactly. Fermented.
breakfast, not go
Yes.
to those fast food things. Yeah,
Exactly.
our dosa, our khichdi, curd, using curd. I
Yes,
mean, even
yes,
the
yeah. It's a
sabudana that was
delicacy, in fact, in
taken
some
by our
places. So,
yeah, so going back to root is the
exactly.
only
I
way that
agree.
we can take care of our health. And as doctor, yes, we get a lot of commercial package, but what is it along with it for them to lure
Sugar.
our children? Lots of sugar. And what percentage of
Correct.
prebiotic or probiotic are they getting with it?
So
Has
I
to
would
be
say,
checked out,
if
right,
you
doctor?
want to have a probiotic, bash at your house, include lot of curds, include lot of dairy products enriched with these good bacteria, and encourage fermenting. That is your dosa batter, idli batter, and also you can include few things like kefir and kombucha. All those also contain good amount of probiotics. So whatever we've been practicing, if we continue, our gut will be happy.
Yeah,
Yeah,
definitely. It seems so simple now that when we understand the
correct.
ingredients that you are mentioning, I mean, it's there in our kitchen,
Exactly.
it is there in our
Yes,
routine.
yes,
We just have to bring them back and be proud of what we have. I mean, we don't want those cereals, we don't want those
yes,
sandwiches coming in and those
yes, yes,
juices in the bottles,
yes,
that fizzy drink we were talking about. So simple, healthy food, healthy Indian food, and
correct.
it will take care of our health. And now the next question I'm taking up, doctor. What is the role of dietary fibers in
Okay. See, now
allergy
dietary
prevention?
fibers, like our gut microorganisms, is again a very not explored part of our diet. What we used to feel is a balanced diet should contain some amount of fiber. Now, fiber will push out the motions and clear our gut. This was all that was understood. Of course, it is correct. Major share is this insoluble component, but we have something called resistant starch and soluble fibers. These are foods which go and sit in our intestine, and they will delay the gastric emptying. Therefore, they basically improve your metabolic health. And second thing is, when the microorganisms act on these, they break them down into a component called short chain fatty acid. Now, this SCFA, what we call in medical terms, is like a big nutrition to the whole gut. The lining improves, and there is a concept called leaky gut. That means there are small pores that open up in your intestine. This allows the toxins to flow in and results in a lot of allergic manifestation. Now, your short chain fatty acid goes and repairs that lining and makes sure that there is no harmful chemicals getting into your gut. In addition, it acts like a nutrition to the lining of your intestine. So that is another important thing. And once these your fiber is broken down, it helps in maintaining your gut microorganism. It gives food to the microorganism also. So there are many benefits of taking a good amount of fiber. And we, like, when we start solids from 6 months only, we start introducing some amount of fiber. Initially, we may give a very small amount, but no need to worry. The recommendation per se is also very less. Initially, up to about 2 years of age, all you need to give is just 10 grams of fiber. 10 grams is like maybe two small bowls of vegetable or a fruit also will be sufficient. As adults, it is advised that we take thrice the amount. That means around 30 gram of fiber. That is achievable with any Indian diet. So that is not something you need to specifically worry about. Just give your child good amount of raw as well as cooked vegetables along with fruits of all natures. That should take care of this thing.
I want you to please stress on this because most of parents during the introductory period they give good amount of
Yes.
ragi, good amount of rice mash, but they do not want
Yes.
to take the risk of giving fruits. They do not worry much about vegetables. One thing is they think carbohydrate is everything. On the other hand, they think that fruits will cause cough or
Yeah.
cold. So please tell them on how it can be
So,
included and why it
yeah,
will
we
not
have
be a problem
also,
for them.
as we practice, we come across these queries because they know that if you put some ghee and give ragi, the baby will grow in weight and they are happy about it. They are always concerned about fruits because, they say,
And then
Yeah,
coming
yeah,
back to
correct,
the
exactly. So
constipation
when
issue.
why we say introduce fruits is, first of all, it's a very good finger food. See, you cut your slices long, your baby can hold it and eat. And you know, the tastes are all so different. They enjoy it, and the colors are different, the textures are different, tastes are different. That is so stimulating for your baby. They will really enjoy eating fruits. First thing. Second thing is, when you start solids, that we know that the amount of iron and calcium, there's a tendency that it can come down a bit because you're not exclusively breastfeeding, and people start asking for supplements. But you know, there are a few nutrients called phytonutrients that can only be got from colored fruits and vegetables. The natural products in the fruits and vegetable, we have not been able to completely replace it. Of course, we can replace iron, vitamin B12, selenium, magnesium, but not all components. That you will only get through whole foods. So it's a very good idea to start introducing fiber in the form of fruits and vegetables, even raw, from a very early age onwards. Of course, there is some, some concerns that will they be able to digest? Definitely, they will be able to digest, because 6 months is a very ripe age. Gut is fully ready to accept all the foods you give, and the intestinal juices that are required to digest any kind of food is there in the body. So you need not worry, and there is no association between any food and especially fruits and cold, cough. There's nothing like that. So please, with no fear, introduce a good amount of fruits and vegetables from 6 months onwards. You will see the benefits in heaps later.
Thank you for answering that, doctor. People, we have two more questions. Meanwhile, if you have anything that you want to know related to the topic, that is gut health, allergy, or foods in general, please post that, and I will take those questions once we are done with this. The fifth question is, doctor, how
Yeah,
are
so allergy
allergies diagnosed?
diagnosis is something we do in our clinic. You tell us your concerns, we see the kid, usually that by that we'll be able to say this is this form of allergy. But the testing is mainly to see what is the culprit. So what is the allergen which is causing a problem? So usually it's done in two forms. One is a skin test, where a skin prick, a small wells are made in the skin. The allergen which is suspected is put in, and we see the reaction. Usually that is done within 15-20 minutes, and they'll be able to give you some feedback about what could be the cause. The other thing we do is a blood test. Whenever there is an allergy, there is increase in a certain substance in the blood called IgE. That is how the body responds basically. So we measure that. Now we have little more advanced testing where we have specific IgEs against particular allergens. So that will give us a lot of information. But more than anything, it is actually a clinical thing that we pick up, and we have to observe. And that we mainly need the mother or the father's help. You have to notice and tell us that, yes, when I expose to this, when I expose to dust, or I expose to some animal hair, or I expose to so and so, then we can have allergies. So.
Okay. Fine, doctor. But in general, we can see through the rashes on the body, swelling of the
Yes.
skin,
So yeah.
near the eyes, some
Yeah, so sorry,
behavioral
I
changes as
missed that.
well.
So what you have to do for in your kid is, when you
Yeah.
see that, usually the kid can have respiratory features, like there's watering of the eyes, running of the nose, then itchiness, and child is coughing, you can hear a wheeze, or a skin, there is swelling around the eyes, then there are rashes, usually over the joint surfaces, over the face, over the scalp, and again associated with an itch. Or they can have severe pain, abdomen, vomiting, loose stools, or any of these maybe, or concerns. And see, these can be also caused by infections, like now viral infections are rampant. So how do you differentiate? Usually we give a gap of 7 to 10. So any viral fever should come down.
Yeah,
7 to 10 days you
10
have to observe. Suppose your
with
kid is having a runny nose for 3-4 days, that may or may not be an allergen, because viral infections maximum stay up to about 7 days. So despite everything, if the child continues to have these problems, then we should also think of an allergen, and you will see a direct relationship. Now my kid went out, and there was pollen and there's sparthenium, exposure to that, immediately child is getting a cough. So we know, yeah, this could be the cause. So we usually take a very detailed history that helps us. So like you help us diagnose that, that could.
Exactly. Parents, all the time, please note things and understand. Don't be panicking about or
Yes.
over conscious, but understand your child or the where you can educate them. Observing are simple things. You just don't have to
Yeah.
note down everything. But
Yes.
I mean, as far as we can remember what we had yesterday, we
But
will know what
if you are
child had
worried about
yesterday, and we
something that
can
is happening
note.
that is happening repeatedly, you can always have a small journal where you enter that this food are what I'm suspecting. So when you go to your pediatrician, that will be a good input actually.
Correct, because even doctor would not magically be able to diagnose something. Only our feedback is necessary for them to do it quickly. Otherwise, it will take months together for them to understand. Even for our health, it is asked, is your menstruation cycle good? And so many medical history of yours is taken. So goes with the child and child's health as well. So let us work towards it and make our life and doctor's life easy. The next and the last question, doctor. What is the treatment being given and what
So
is new with respect to gut? In case of what is the new
So
treatment,
like
I think,
the
and
gold
what is new
standard
with
for
respect to
allergy
gut?
management is avoidance. So you avoid the allergen, you are safe. But easier said than done because we live in a shared environment. There's so much pollution and there's so much happening outside that you can't sometimes avoid always. So, but your internal environment is one thing you can have a control over. For a lot of allergies, actually, indoor air pollution is more important than outdoor pollution. So when you're cleaning, please be mindful of the corners and the curtains that we use and the carpets we use. Yes,
I was about to
exactly.
say that the
Yes,
pillow
they
covers, the
tend to
curtains,
hold
the
on to
bed
the
spread.
dust mites very
Yeah.
vigorously. So make sure that periodically you are cleaning those surfaces. And we always tend to clean the floors, but the walls also need to be, wiped down. So that is one more thing that you can take care of. And if you stay in a place where there's a lot of dust, lot of, pollution, you can always plan to get an air purifier. That will help. Then with respect to food allergies, of course, avoidance is the best. But, with the help of your doctor, we do something called immunotherapy. That is, we introduce the suspected food allergen in very small quantity and build up the immune system to tolerate it. But all this, of course, is done with extreme guidance only.
When you say, I'm sorry to interrupt. When you say to tolerate it, do you say that in case child is allergic to something now, in
Yes.
a while there are
Yes.
chances that the baby will be okay with it? We can
Yes.
still give that
Something
allergen
like
after a while.
milk. No, that
Is it
like something
still?
like cow's milk. Lot of children after about below 1 year are not able to tolerate cow's milk. Like they don't have the capacity. Sorry, I mean to say like within 1 year, a lot of children are allergic to a component in the cow's milk. But we have noticed that about 70% of these children outgrow that allergy. But this is very subjective. Like I said, this is on individual basis. There are different foods which react differently. Like something like a peanut allergy is something that people cannot outgrow. But something like cow's milk allergy or egg allergy, children, we know that as they grow up, the allergy comes down and people can tolerate the food. Usually under your pediatrician's guidance, we do this. Like suppose a child has egg allergy. First, of course, they have severe manifestation. So we encourage first to start with little amounts and cooked egg. Then we encourage you to give a little bit of increase in the amount. And by the time child is about 3 years, they can tolerate. These are all very individual treatments. So that you have to, it is tailor-made for the baby basically. So this is about the food allergens. And we know in asthma, we have a lot of drugs. Asthma and, rhinoconjunctivitis, we have a lot of drugs which bring down the symptoms and make life better for the baby. Like the sneezing comes down, itching comes down, then your wheezing comes down. These are very much required. Preventers and controllers are there, which are very good and improve the quality of life of the baby till you learn to handle the allergies. But I want to talk about what is new with respect to gut and allergy. So, how we were talking about vaginal birth, now research is going on about something known as vaginal seeding. So, what they are thinking is that even for a mother who's going to deliver through a cesarean section, 1 hour prior to the birth, they want to harvest the microbiome and then expose the baby to the microbiome. So, you get the best of both worlds. The mother is safe, baby is safe, as well as you are harvesting the healthy bacteria from the mother. So that is a thing that where research is going on right now. And in addition, I'm sure in little amounts you have heard about something called fecal transplant. So fecal microbiome transplant is when a baby has very severe dysbiosis, which is resulting in a lot of issues. We tend to take a healthy microbiome from a healthy person and we introduce it into that patient so that we help them in dealing with the certain conditions. So these are all upcoming things which I don't know, in maybe 5 years will be a reality. And we'll be, instead of just symptomatic treatment, maybe we'll be giving these. And it can change their life forever. Hopefully it will become a reality. And this is how like the gut will maybe help us treat allergies better. So that is the hope actually.
Okay. Related to this, now we all know vaginal delivery is good, is best for a child. But if not, now I also had two C-section. One was because one was a preemie, the other one was doctor did not want to take risk. The other one did not come at all. The first one was born earlier, the other one did not want to come out at all. So there were various reasons that we was out of control. Now two C-sections and considerably gut health would not be as great as if they were born vaginally. So what is it that a mother can do? What is it that something in the hospital we can ask the doctors to do?
Yeah.
Is there something like
actually,
that? Is there any
first
study?
thing is, however you have given birth, please don't have any two thoughts about it, because at that point, having a healthy mother, healthy baby will be everybody's priority, and that is not something you can control. So no need to worry about it at all. So going forward, how we can improve is a lot of bonding time. So when you have a lot of skin to skin contact, then you are bringing a lot of mother's good bacteria in contact with the baby.
Doctor, one call you only to talk about skin to skin because it has immense benefits and our people take it for granted. And skin to skin is not just for mother and baby, even caregivers like grandparents, father, everybody should keep doing this. It is amazing. So I will call you one day to only talk about skin to skin.
According to the guidelines set for us, rooming in is the most important. Mother and child under no circumstance should be separated actually, unless there is something that needs to be taken care of. They should be together. That is one thing that you can follow. Second, and the golden substitute for anything would be breastfeeding only. So the earlier you start, give colostrum, continue to feed how much ever possible. So that will definitely help, and it will definitely compensate also for any lack of, the vaginal microbiota. And in addition to that, after 6 months, like how we discussed, please follow. It is like the critical 1,000-day period. So we say it's the 1,000-day rule, where you have just up to 2 years, 1,000 days to help in developing your gut microbiota. So actively work towards it. Don't give anything that is unnecessary, lot of sugars or lot of processed food. Please avoid that. Everything should directly come out of the kitchen, and fresh should be made immediately and given, and include all local substances, which you are also an advocate of. So we should definitely encourage this behavior. Stop following the westerners and trying to incorporate them, because by inviting more trouble, we are getting all the problems that we never had before.
We have so many in place of strawberry, we have so many millets in place of quinoa, so don't fall prey.
So just be low. So that will just solve all this. This is what I feel is.
Thank you so much for patiently answering so many queries of mine. There are few questions I'll just ask you which have been posted by our audience. One I see, 1 second. Okay, Shravan Bhagi says it is an informative video. Thank you so much for taking time and telling that. It keeps us motivated to do things like this. Okay, I don't know the name of the person, but ASR 6916. One doubt on baby pooping observed after a new food is introduced. Sorry, baby doesn't poop the next day. I think it's okay,
The
doctor. What
stooling
is your
pattern changes a lot from birth to the whole period of pregnancy. You would have seen that initially your baby is passing motions maybe once a day, and suddenly you see after a week they are passing 6 to 8 times. Everybody panic calls telling they have loose motions. That is nothing but your transitional stools. Later, your baby's frequency of motions will come down. There is pooping only once in 2 to 3 days, which is absolutely normal. In fact, you can wait up to 5 days. Of course, keep your pediatrician informed, but we can naturally wait 7 days before we do something actively. The gut, each baby's is unique, and it's getting used to that new food. So there's nothing you need to do for that. Continue to feed, nothing is going to happen. Don't worry.
Thank you. There's next question from the same ID. Does nutmeg or jackai disturb the gut health? It does suggest to give it to babies. It is suggested to be given to a newborn baby.
I personally feel that up to 6 months, nothing. I mean, they give jaikai, bajet, and colicate, bonesan, and gripe water. Please avoid everything, because your breast milk is complete. It has everything that baby needs. So other
It is curated according
there's
to your
nothing that
baby's age.
jaikai or anything can give in addition to your breastfeeds. So strictly stay away from anything else which they advise. I know it's an old thing, but now you can't even be sure of the purity of what you're giving to the baby. And in addition, you're introducing so many, unwanted substances, which in addition comes to that particular food. So I would not advise below 6 months at all, because you try to do something good. Sometimes we have kids who come back with a bad, infection because of the same. I really do not advise giving this gripe water and bonesan. They are all substances which changes the pH of the stomach. Stomach, which was previously working perfectly fine, able to digest everything, becomes more alkaline. So, the digestibility also comes down. Baby is struggling. It's just for instant relief. Please avoid this. Your baby will have lot of, patterns. Sometimes they poop every day, sometimes once in 2 to 3 days. Sometimes they are just, if you have not burped the baby well, yeah, they'll act very irritable, they'll arch their back. Just ensure that you feed nicely, burp the baby well, and just leave them. They will thrive.
Don't put your
Please don't worry.
consciousness onto your
Person
child.
not advise
Let them
nutmeg.
relax. So does it disturb the gut health? Nutmeg, when maybe let us assume it is after 6 months, somebody is adding on to nutmeg or giving it on a regular basis.
Mainly it helps in the digestibility, they say. Maybe after 6 months, if you want to introduce in very minute quantities and occasionally, I guess it is okay. Depends on your beliefs.
Not more than a drop or two of it when you add it, and please consider including hygienic substances
Source also.
and
Source
the
of
vessel
your,
that you use.
whatever food. And, yeah.
Doctor, the next question is by Pranali. My baby is 9 months old. I have not introduced finger food. May I know how? She's not put in how or why. May I know to introduce it? So not actually related to the topic,
Yeah.
but I'm sure they would love to hear it from you.
Like I told you to look for cues that baby can feed at 6 months, 6 to 7 months. Babies are not only ready to accept feeds from you, but also you must have seen as they come to 6 months of age, they start grabbing from your food plate. Start grabbing everything. So they have developed the oromotor skills to grab the food, put it in their mouth. So how you can encourage this is you have to have some bite-sized foods, usually avocado in long pieces or the apple in long pieces with the skin. And if you're giving even something like a porridge, put it on a spoon and give the food to the baby. What they do is they learn to handle it with their, they learn to hold it and handle with their hands, and they try to put it in their mouth. So this is building their development, as well as it is helping them explore the texture. Now, if you make avocado as a paste, sapota as a paste and give, then there is only one texture, smooth. But if you give the whole food, then there is a lot of benefit. Your baby is able to see, feel, baby is able to appreciate the texture, the taste, So that is a practice that now we are trying to inculcate in complementary feeding. Basically, I would say start off with whatever is safe, like something like an avocado, or you can start off with some other fruits or steamed vegetables which your baby can easily hold, and let them feed themselves. But important thing to note is be around the child. Always it should be supervised. Child should be seated up, not giving when the baby is sleeping or in an abnormal position. They should be seated straight up. Maybe a high table will be a good choice, high chair. And you have to be around to see that baby is feeding. And don't be worried if they gag a bit. Their gag reflex is.
Next question, I just noted down difference between gagging and choking. We all assume that our child will choke.
Gagging is something that when it stimulates the posterior part of its throat, they tend to do that gag. So that is actually a protective mechanism. So be around. Every bite you have to notice how well the baby is able to accept. And initially the amount which goes in is this much and they spill all around. But even that is very much encouraged because you're helping them develop a taste for the variety, develop a taste for the different textures, so that we can avoid this picky eating at an older age. So I would like to tell her to go ahead and give all kinds of food to her 9-month-old.
Well said, doctor. The next question.
Multiple episodes of sneezing. That is a rare thing, like a rare component. Usually, very few children have that. But if you're asking about fan, I think the major concern would be the surface of the fan. There might be dust and which have been sitting there that needs a thorough cleaning. But this, per se, wind-causing allergies are a little bit rare. So you should just see if the surface of the fan is clean periodically. So that might, yes.
Also
Correct.
Okay, doctor, thank you so much. The lady who asked us the question about the nutmeg and pooping, she's put in her name as Anuka and she thanks both of us. She says it was an informative session. Thank you, Anuka. And there are a few more questions which are not related to the topic. As it is almost an hour now, I would close it and I would make way for you to carry on with your patients. Dr. Smrithi, it was an amazing session. I cannot tell you how happy I am understanding things which I didn't know, understanding about the new realities that are happening in the science space about gut health. And I would be really eager to understand that with you further. And there are so many things I can call you. Next is what I also understand. So please keep making some time every now and then for our audience and for the brand to invite you. And people, please, please follow doctor's account, which is Arka Health of their hospital's account. It is. I see a lot of informative posts being coming there, and I request doctor to please make short videos so that our people, all the community will get benefit. I know it is not an easy task. I mean, being in business, being in the industry, for us to bring in editors and get that done is a task altogether. I really hope you can get somebody to help you with that. You must. Yeah, please do something like that because even small videos coming in from you will be, I mean, it would be a right way or right space for them to trust on and move forward with the information and take good benefit out of
things like breastfeeding and infant feeding, because these are small things. If you just get it right, you don't have to worry about medical.
I have a 4-year-old. Trust me, doctor, I have breastfed them almost 20 to 22 months. And now, I mean, people may want me to say touch wood, but my children do not have health issues as such. Even their food habits are decent enough because we gave them a lot of food varieties. And this is what we see. In the initial stages, I'm sure every parent will find it difficult. It is not easy to parent. And it is not easy to understand scientific things and add it on to the regular life in the busy world that we are in. But if we do take care of those minute things in the initial days of their birth, like breastfeeding and taking care of good health and post delivery. I mean, breastfeeding and also later, as you said, the right form of solid introduction, introducing them to all the allergens. All this is something that we all have got it as a tradition and a culture. Let us not fall prey for Western habits. Let us pick something which is nice and which suits us, as Dr. rightly says. And for people who have joined in now, guys, I'll save this video. You can go through it in detail later. Dr. Smrithi has answered amazing questions in much simpler way without using scientific words, which will be a jargon for anybody to understand. But thank you so much. Kudos to you, doctor. And we would love to have you back here. Anything at the end of the video, please let our audience know. And people, if somebody is there from other account or for the first time, I'm Kavitha, founder of Tots and Moms Foods. We have an organic food store which you can just check on our page later. Over to you, Dr. Smrithi.
Well informed and such an enthusiastic. I'm happy, you know, mothers. Everybody finally just want the kid to be healthy and the kid to be doing well. So yeah, it's great to contribute to such a community. Thank you so much for the opportunity.
Thank you, doctor. Thank you, Savita. She says it's an informative video. The passenger 09 also says very informative. Thank you. Thank you, everybody. Your appreciation matters a lot. And good day, doctor. Good day, everybody. Bye-bye. Thank you.